Imagine this for a moment. You are 74 years old, and life feels stable. You wake up each morning with enough energy to enjoy your routines, spend time with family, work in the garden, travel, read, or simply enjoy the freedom that retirement has given you. You are sleeping reasonably well, staying active, and aside from the occasional ache that comes with age, you feel healthy. Nothing seems wrong. Then one day, you attend your annual physical exam. It is supposed to be routine, just another item to check off your list. During the visit, your doctor reviews your chart and casually suggests running a few additional tests. The recommendation sounds harmless. After all, who wouldn't want to be extra careful? Weeks later, everything has changed. Those precautionary tests uncovered something unexpected. Suddenly, you are meeting specialists, discussing procedures, and facing decisions you never imagined making. Not because you felt sick, but because one finding triggered another, creating a medical journey your body may not have been prepared to endure. This scenario is far more common than most people realize. Welcome to Vital Aging. Our mission is to help adults over 60 understand what medical research actually says, in language that is practical and easy to understand. Today, we're exploring an important reality that rarely gets discussed openly. After age 70, some routine medical screenings may carry risks that deserve much closer attention. The goal is not to reject medicine, but to understand when medical care truly helps and when it may unintentionally create new challenges. To understand the rest of this discussion, we first need to look at a concept that changes everything about health decisions later in life. Here at Vital Aging, we call it the longevity lens. Without understanding this idea, many of the recommendations and concerns we'll discuss may seem surprising or even counterintuitive. When a person is in their 40s or 50s, preventative screening often provides tremendous value. Detecting a problem early can lead to treatment that prevents complications decades into the future. In those situations, the benefits frequently outweigh the risks because there is a long time horizon ahead. The equation is relatively straightforward. However, after age 70, the equation begins to shift. The first reason is that many conditions discovered through routine screening grow extremely slowly. Some abnormalities may never cause symptoms, interfere with daily life, or shorten lifespan. Yet once the fourth checkup requires a more nuanced discussion because it involves a condition that is undeniably serious. Osteoporosis and age-related bone loss are major concerns for older adults, and fractures can dramatically affect independence and quality of life. However, the issue is not the bone density scan itself. The concern is the automatic treatment pathway that sometimes follows the results without a broader conversation about overall risk. A DEXA scan measures bone density and helps estimate the likelihood of future fractures. When the results show reduced bone density, many patients are quickly prescribed medications intended to strengthen bone and reduce fracture risk. For some individuals, particularly those with a history of fractures or very severe osteoporosis, these medications can be beneficial and appropriate. The problem arises when treatment becomes almost automatic, regardless of a person's overall health profile. Many older adults assume that once they begin medication, they have solved the problem. Yet medications are only one piece of the fracture prevention puzzle. Some drugs used for osteoporosis have been associated with uncommon but potentially serious side effects, especially after long-term use. While these events are rare, they deserve consideration whenever a treatment plan is being developed. What is often overlooked is that the majority of fractures occur because of falls, rather than because bones suddenly fail on their own. This shifts the conversation toward prevention strategies that may have a greater impact than many people realize. Improving balance, increasing muscle strength, correcting vision problems, reviewing medications that cause dizziness, eliminating household hazards, maintaining adequate protein intake, and ensuring sufficient vitamin D levels can dramatically reduce the likelihood of a dangerous fall. For many older adults, the most important question is not simply whether their bones are thinner than average. The more meaningful question is what combination of lifestyle changes, fall prevention measures, and medical treatments will provide the greatest protection while preserving health,